Hi, my name is Dr. Matt Hotton, and I'm a clinical psychologist with the Spire's Cleft Lip and Palate Service at the John Radcliffe Hospital in Oxford. I've been with the team for just over 6 years now, so that was 1 year as a trainee clinical psychologist and just over 5 years as a qualified clinical psychologist. And as a clinical psychologist in a cleft service, I work with families, children and adults who are born with a cleft lip and palate, and to support them, I guess, in the early years, to especially with parents, to support them to adjust to having a baby or a young child born with a cleft, and to support them through any surgical or other types of interventions they might have to undergo. And then as children get older, as clinical psychologists, we work with those children to help them to feel confident about discussing their cleft with other people, and to generally just feel confident about having been born with a cleft. And equally, if there are aspects of having been born with a cleft that they're bothered or concerned by, we work with them to kind of equip them to have tools to cope with that. And as they grow even older into kind of school transition and beyond, we regularly review young people in clinics to make sure that they don't have any worries or concerns in relation to being born with a cleft. And if they do, we'll work with them to address those concerns. And we'll often also work with people who might have concerns about their appearance, who might want to undergo surgery, and we'll often carry out what we call kind of assessments before surgery to check that an operation might be the right thing for them, and also to support them through any operations that they might have over the years.
Question 2. What is the best part about a career in cleft care?
I mean, there are so many different things, it's really hard to do them justice. I mean, typically as a clinical psychologist in the NHS, we would normally work in quite a reactive way in mental health services. So we wait for problems to arise and receive referrals for young people or adults experiencing a high level of psychological distress, kind of once those difficulties become severe enough for treatment, which in my mind is often too late. And a lot of evidence would suggest that early intervention and preventative psychological input is kind of a more effective way to go, and we have that luxury in cleft care. So as psychologists in cleft services, we work in a very different way to our mental health colleagues. We build relationships with families right from birth or even from pregnancy, and that way we can work closely with those families to aim to prevent any difficulties emerging in the future, and to spot them through regular screening in clinic if difficulties do emerge. We support young people and their families to adjust to any challenges kind of associated with the cleft lip and palate over time. I guess also for clinical psychologists working in mental health services, they're typically one of many mental health professionals working within a team, whereas in cleft care, we are part of a truly multidisciplinary team, and it provides us the opportunity to not only kind of offer a unique perspective as the mental health professional or psychologist in the team, but we also get to learn from a kind of very different disciplines and different kind of specialties, which is constantly kind of enlightening. It's also such a pleasure to collaborate with other clinical psychologists in the UK, and the UK Cleft Clinical Psychology Clinical Excellence Network is a really supportive and productive and dynamic forum for sharing best practice and shaping national guidelines. And on top of this, there's lots of regular opportunity to engage in research with both our kind of clinical psychology colleagues, but also academic psychologists.
Question 3. What is the most challenging part of working in cleft lip and palate?
So I guess one of the biggest challenges is that you have to have a very broad set of skills. So clinical psychologists, again, working in mental health services, typically specialize in working with children and young people or their families, working with adults of, say, a working age, or working with older adults. Whereas in cleft services, we offer a lifespan service. And as such, as psychologists, we're required to have skills working with people of any age. So that means we have to have kind of a broad set of not only skills, but knowledge of different developmental issues and different theoretical perspectives, and be able to work with people experiencing a wide range of difficulties, both in relation to maybe appearance, but also speech difficulties and other functional difficulties, as well as other kind of common psychological difficulties that might be experienced by people undergoing regular medical or surgical treatment. I guess one of the bigger challenges at this specific point in time is that as a result of the COVID-19 pandemic, people up and down the country and especially kind of in hospitals, are experiencing delays to surgical treatment. And it's been really difficult to see people born with a cleft and their families having to manage the uncertainty of when they might have an operation or whether that might be delayed.
Question 4. What excites you the most about the future of cleft lip and palate care?
So I think that cleft care typically is at the cutting edge of using patient-reported outcomes. So there's some really nice and innovative tools like the Cleft Queue, which also has kind of computerized adaptive versions, which are very clever and effectively allow us to really continue to focus on the individual outcomes. So not only outcomes in terms of their physical health, but also their psychological well-being. And what this does is it means that we can slowly move away from kind of generic interventions and generic treatment pathways to hopefully being able to provide really tailored person-centered care. It's something that we already do, but I think this use of kind of really specific patient-reported outcome measures will help us to tailor things in an even more kind of bespoke and person-centered way.
Question 5. What advice would you give to a student or trainee interested in the cleft lip and palate specialty?
Well, I guess unlike lots of our MDT colleagues in the cleft service, there isn't actually any specialist training required to be a clinical psychologist in a cleft service beyond the doctorate in clinical psychology that all clinical psychologists have to be able to practice. So I think in many ways, there are lots of doors and avenues into being a clinical psychologist in the cleft service. But that being said, especially to trainees, if you're interested in if you're a trainee who's interested in working in cleft care, it can be really helpful to request a specialist training placement as part of your doctorate and to request that to be as part of a cleft service, or at the very least within a clinical health psychology team. For people who are maybe at an earlier stage in their career, maybe psychology undergraduate students, a lot of psychology degrees now offer a sandwich year, so a placement year in either industry or in a clinical placement. And again, lots of cleft services up and down the country offer honorary assistant psychology posts to undergraduate students so that they might get a flavour of what it might be like to work in the cleft service. I guess my overall message would be just reach out to any clinical psychologist in your local cleft team, contact the local cleft team, ask if you might be able to speak to one of the clinical psychologists in the team. I'm sure they'll be really delighted to talk to you about different avenues and ways of kind of joining a cleft service in the future.